There we go. I'm going to start back at the beginning here. Okay. So as Danielle said, my name is Christa Reiter, and I am the supervisor for Lifescape's Senior Mental Health Program. I'm here today to talk to you about our newest program that targets depression in older adults 60 and over that reside in Winnebago County. Our program is funded by a grant from the Winnebago County Community Mental Health Board. We have so many excellent programs here at Lifescape, and so I just wanted to give you a brief overview of some of those. So our first one is our Senior Choice Program. We have caseworkers who will offer assistance to folks, with managing their benefits, doing a screening to see what benefits they're eligible for. They can help with transportation. We can help with LIHEAP applications, a vehicle sticker discount, helping folks manage Medicare and Medicaid, support for family caregivers, and we also have a grandparents raising grandchildren program. Our adult day program can provide a safe environment for older adults with cognitive disabilities, giving them a place to socialize and receive support services. Transportation can be provided to that program, and there's a nurse on site. Our health promotion program promotes health and wellness by offering programs that encourage movement and exercise, such as bingo size, a matter of balance. These are usually held at community centers or assisted living facilities, and they can run for 6 to 8 weeks. Our nutrition program is what most people have heard of when they think of Lifescape. That's our Meals on Wheels program. Clients receive nutritious meals delivered to their door, and we also offer senior dining options where folks can eat in restaurants such as Nancy's Diner in Winnebago, Ned's Restaurant in Belvedere, and at the Keenage Center in Belvedere. All of our meals are a suggested donation, and we don't turn people away due to the inability to pay. Our AmeriCorps Senior Volunteer Program. AmeriCorps Seniors, it's one of the largest volunteer networks in the nation for folks 55 and older. Our volunteers help support programming. We offer a friendly caller program where volunteers are paired with a client who kind of wants someone to talk to. Maybe they're in their home and there's that isolation piece and they're feeling lonely. So they'll receive weekly calls from a volunteer, and then they're able to have somebody to talk to. Our program, the Senior Mental Health Program, utilizes a volunteer 3 hours a week to help with our depression screenings. So through providing all these services for seniors all this time, Lifescape noticed that there was a gap when it came to addressing the mental health needs of older adults. So that's where our program comes in. Everybody feels unhappy or sad at some point in their lives, but someone who has persistent, ongoing sadness that lasts for 2 weeks or more may have depression. And unfortunately, depression is frequently underdiagnosed and undertreated in older adults. We all need those social connections to survive and thrive, but as people age, they often find themselves spending more time alone. Studies show that loneliness and social isolation are associated with higher rates of depression. Depression is a chronic disease of the brain, and it is not a normal part of aging. As a person ages, the signs of depression are more likely to be seen as crankiness or grumpiness or just someone getting old. Depression can be tricky to recognize in older adults. Confusion or attention problems caused by depression can look like Alzheimer's or other brain diseases. Mood changes and other symptoms can also be caused by medications that older people take for health issues. The diagnostic criteria is the same, regardless of your age. The way the symptoms show are different. There may be increased reports of physical pain, changes in appetite, that confusion, being unable to make decisions, and having some memory problems. There's a connection between our mental and physical health, and we know that about 80% of older adults have at least one chronic health condition, and 50% have 2 or more. Depressive symptoms can also be triggered by health issues. And then there's also so many life changes happening, during this time in a person's life. Maybe you've lost your spouse, your friends are passing away. Maybe you've lost your independence and you've had to sell the family home. Maybe your functioning and the way that you've been able to take care of yourself has changed. Finances, could definitely be a struggle. If you're trying to live on Social Security and trying to stretch that to cover everything, that's very stressful. Role changes and personal conflict. Maybe you were the parent for all these years, and now all of a sudden you find yourself needing help from your children, and that can definitely cause conflict. Social isolation and loneliness is big during this age group. Like I said, the medical issues that are happening, depending on where you live, you might be exposed to crime and violence, housing instability, again, coming down to the finances. And we know that depression is underdiagnosed and undertreated in minorities, and that they often lack access to mental health care. It is so important to seek help for depression. Depression is not a normal part of aging, and it is not something that people have to live with. Left untreated, it can lead to a lower quality of life and functioning. You're at an increased risk of substance abuse. Healthcare costs could go up. It may take you longer to recover from physical illness. Relationship problems, problems with sleep, and an untreated depression is the main cause of suicide in older adults. As you can see, the two highest age categories for suicide are 85 and over, and then the next one is 75 to 84. This can be because people are less likely to share their thoughts about suicide, and they may plan carefully, use more lethal means, and then are less likely to recover due to physical issues. Don't be afraid to bring the topic up. It is a myth that if you ask someone if they're thinking of suicide, or if you bring it up, that you're going to put the idea in their head. And I guarantee that if someone is struggling with clinical depression, the thoughts are most likely already there, and they might be relieved being able to talk about them. If you or someone you know needs support or is struggling with these thoughts, you can call or text 988. There's trained counselors there 24/7. Even if you just need to talk to someone, they can give you support and some guidance as what to do next. So there's some ways to prevent depression or to help alleviate some of those symptoms for those that are struggling. These are what we call the protective factors. So remaining active and maintaining your emotional support, having social support. So maybe get out if there's a senior group at your local church, or things at the park district, or if you live in assisted living, join in the community activities that are there. Continue to see your friends and family if they're still there. Positive life outlook, life satisfaction, having a purpose in life. So many folks find that when the kids are raised and you're not going to work every day, well, who am I and what's the point now? It's important to find a new purpose and some new passions in your life. Take your medications as prescribed. Make sure you're eating and sleeping well. As I said, the social activities, and this kind of self-care may prevent depression, or it may also be a part of the treatment for it. So now that I've kind of touched on depression and what it is, I kind of want to talk a little bit about our program and what we're doing specifically here. So as I said, with the grant money provided, we've started our senior mental health program that focuses on depression in older adults. Our mission is to assess for depression, educate people about depression and mental health issues, and refer clients to support in the community so that they can get the help that they need. Healthy Ideas is the curriculum that we used. It's an evidence-based curriculum that targets depression in older adults. The objectives for this program are screening for depression, educating older adults and families about mental health and recognizing the signs and symptoms of depression, diminishing that mental health stigma around getting help, and then we provide case management and help connect folks to services that already exist in the community. So once our assessments are complete, we can encourage our clients to seek help with a professional, whether it's their primary care provider or a local mental health agency. Our program, our Healthy Ideas program, can be the bridge between the client and treatment. And whether or not somebody chooses to seek help, we still continue with our program. So the next step that we use after we've already assessed somebody is to engage them in something called behavior activation. So that's an approach to depression management that helps clients combat the inactivity commonly associated with depression. So when we feel depressed, we sometimes stop doing the things that we enjoy. And when that happens, we begin to feel worse, and so we do less. And so as you can see on the left side of your screen, you kind of get in this vicious cycle that you just continue to spin in depression. So using the chart on the right, we help them identify activities that they enjoy, and we help assist in outlining ways to get there. So one way to feel better is to take time to do those things that they enjoy. So there's definitely a link between our activities and our mood. Despite more awareness of this illness, it still carries a stigma that prevents people from talking about depression and from seeking help. Some people are afraid of being labeled as crazy. Maybe they'll lose their independence. They don't want to be thought of as incompetent. Many older adults grew up during a time when seeking help and talking about mental illness was taboo. Mental illness was once viewed as a shameful moral failure rather than a health condition. People with severe symptoms were institutionalized. This age group also grew up during global catastrophes of poverty and war, inequality, and violence. During the Great Depression and World War II, survival was the goal and sacrifice was a virtue. You know, what happened in the house stayed in the house, and we don't talk about things in public. So we have many folks who agree to be screened, and then they qualify for the program, but they decline to participate. So the education component of Healthy Ideas addresses this by teaching people that depression is a real health concern and it is treatable. And the hope is that by educating people, we can change the attitude around mental illness and seeking help. At the start and the finish of the program, we administer something called a perception of care survey, excuse me, that measures the client's attitude towards depression and treatment. So the following statements are part of that assessment that we use to gauge the client's attitude towards mental health. So the first statement is, most people avoid contact with someone who has been treated for mental illness. Most people take the opinions of someone who has been treated for mental illness less seriously. Most people think someone who has been treated for mental illness to be dangerous. Most people think badly of someone who has been treated for mental illness. And then most people consider mental illness to be a sign of weakness. Now imagine if you're someone who's really struggling with depression and you also have these beliefs. You're not going to seek help. You know, we need to have more conversations about mental health and that it is a treatable medical issue. So depression is it's not bad hygiene. You know, maybe someone is too tired to prioritize. They're not lazy. Mentally and physically, they're just struggling to exist right now. And maybe they're not getting up and bathing and, you know, changing their clothes or cleaning their house. It's the symptoms of depression. They're not, you know, negative. Now, the reality is maybe they feel like a burden for being sad. Maybe you think they're just being dramatic. You know, the reality is that people cannot just snap out of this. I love this cartoon. I like to call this unhelpful advice. You know, we treat our mental health very differently than we treat our physical health. You know, what if we said some of these same things to folks with physical issues that we do to people with mental health issues? You know, the first one is someone laying in bed ill. You know, I get that you have food poisoning and all, but you have to at least make an effort. You know, the next one, this poor person looks like they have their hand cut off. You need to just change your frame of mind and then you'll feel better. You know, someone who has diabetes or high blood pressure just can't think positive and their illness will go away. A person with cancer can't try hard to not have cancer and then their illness goes away. Depression is a disease of the brain and it can be treated just like any other illness. And I think if you take anything away from today, please know that depression is not a part of aging. You don't have to suffer, and that help is available. And here's the contact information for myself and for Lifescape. If you are interested in any of our programming, you can just call our main number, and we have a real live person who answers the phone, and she can direct you to whatever program you're interested in. Thank you so much.